Oftentimes, new clinical trial results are presented at a healthcare conference. In this video, I'm going to show you how to surface and monitor the reaction of the medical professional community to such an announcement. Now, this dashboard is looking at the ESC Congress hashtag during the exact dates of the event, and we can see that there were over 50,000 tweets in all. What I want to do is uncover the reaction to the results of the Emperor Reduced trial that were presented during that event. And I'm going to place a word filter here for the name of the trial, Emperor-Reduced. I'll make a comma, and I'll re-enter it, but this time without the hyphen. Another comma. This time I'll use the hashtag Emperor-Reduced. And I'm going to go ahead and use the actual drug name that was used in the trial. Then I'm going to hit the run button. And here we've uncovered 2,150 tweets in all. That sounds good, but here's the problem. As news of these results begin to travel across Twitter, others will jump into the conversation and begin sharing their own reaction, but without the conference hashtag. So a better approach may be to use a starting point that's different than the conference hashtag. Let's take a look. Over here, I've got a dashboard that's set to those same dates as the ESC Congress, but it's using the keywords Emperor Reduced, both with and without the hyphen, and it's using the hashtag Emperor Reduced as the data sets to populate this dashboard. And again, we're also using the drug name that was involved in the study. And I feel safe doing that because, like on the other dashboard, it's highly likely that any use of that name in a tweet during the dates of the Congress are going to be in the context of that trial. Now you can see that by taking this approach, we've actually nearly doubled, actually more than doubled, the amount of tweets that we're capturing. And we can see on the engagement activity report, if I switch to totals, that it was the doctors who were overwhelmingly the most active in talking about those results. If I look at the network analysis, I can see how much activity there was between these physicians sharing this information with one another. And I can see on the influencer report which doctors were being most influential in this discussion. And if I click on their Twitter handles, I can actually bring up their personal transcript to see what exactly the messaging was that they were sending out. I can see the information they were sharing, and in some cases, they're specifically calling out their colleagues, drawing their attention to this study's results. I can also see which of these doctors were most actively sharing information by switching the metric to tweets. I can move down to the Engaging Tweets widget, again, filter for doctors, and see which tweets being made by doctors were attracting the most significant attention. Or maybe what polls doctors were putting out there to gauge their colleagues' opinions. And by clicking on the poll, it'll open up right there in Twitter and I'll see the results. And if I feel so inclined, I can come to the very bottom of the dashboard and add the transcript widget itself and just start reading through one tweet at a time. All of this will help you to gauge the reaction of healthcare professionals as individuals or as a group. And you can observe the reaction of your own identified KOIs or perhaps discover some new strong voices in the crowd that you were not previously aware of. Certainly, you'll be able to assess whether or not the results were properly understood. And with all the insights, you'll be able to lay the groundwork for successful messaging moving forward.